Hi guys, how are you doing today? My name is Kidneyjay. The J stands for jerk because my kidneys are a pair of jerks. And you're thinking, Miss KJ from the hospital bed, what are you doing making a video? Well, I'm actually feeling better today, and I saw Foodie Beauty uploaded this clickbaity title. I think it was called Taking Off My Hijab. I'm not here to talk about any of that. I am here to talk about the Canadian healthcare system and dispelling things she is saying, and just using it as an excuse to not get treatment for her type 2 diabetes. Not only to not get treatment, but to follow through with the inevitable, which she absolutely does not want to do, which would be medication, multiple appointments, diet, diabetic diet. It is what it is. It's a diet. So yeah, we're going to get into that. Before I do get started, don't forget the like button. Appreciate that. Subscribe if you're new. Thank you, thank you, thank you. I do have membership, so if you want to support my humble little channel that way, you can. So let's hear what she has to say about the Canadian healthcare system and wait times,
So,
etc.
yeah, I'm just busy visiting. I'm going to be visiting people and taking care of appointments and everything like that. I have a lot of appointments to do. And I'm running into a wall because the wait time, I called around, for most family doctors is like 2 to 3 years.
Okay, so it is no secret we have a shortage of family physicians here in Canada. But let's just rewind to the Foodie Beauty history here. She had ample opportunity to get herself set up with a family physician before she left for Kuwait when she was first diagnosed with type 2 diabetes way back in the day. She has gone to a thrombosis clinic, which I believe she was dumped for non-compliance. That was for her blood clots. If she were to go to an ER or an urgent care facility today and say, listen, this is my history, they do the blood workup, they would get her in contact with a family physician, a diabetes clinic, ASAP. So 2 to 3 years, maybe if you have no other history. She makes it seem like she's going to walk into Canada, uncontrolled type 2 diabetic, and they're just going to let her like rot for 2 years. Lies.
I mean, that's where the healthcare system is failing. Right now, let's say at the Montfort Hospital, okay? Right now, I saw on the news, the wait time at the emergency is 20 hours. So
what? Decide not to go because it's convenient for you not to go right now. You're not using it for clicks. You will be soon. You're not using it for natter sympathy. You have used the ER system as your personal doctor for years because you couldn't get your shit together to follow up with your own primary care doctor, your own specialists, all that. So that's bullshit. Now, 20 hours is a long wait, and it may be at that hospital, but let me just tell you, I walked into my local hospital in Ontario with hip pain around 10 p.m. on a Monday. I had a CT, I had an x-ray, and I had a diagnosis by 4 p.m. By the next day, I was dialyzed and in surgery by 3 p.m. to get a total hip replacement. Didn't cost me a dime, did cost me some time, yeah, definitely. And let's also not pretend that one of the reasons why our ER systems are overloaded is because of non-compliant patients like Chantal. I also want to say I do not get special treatment because of my dialysis patient. Actually, I found the opposite. Maybe I'll talk about that experience another time. But yeah, definitely not fast-tracked. That was a normal, typical order of operations and time.
look, it's just, I don't know how long it's going to take me. And that's why I'm here indefinitely for now, because I don't know when I'm going to be able to get the healthcare that I need. And, there's long wait lists and I have a lot to take care of. So I'm just going to need to be here for a while. And
And I don't care about the relationship between her and Sla, whether she's just getting away from him, whether or not he's getting rid of her. Yeah, it's going to take time, but it's also going to take. It's a two-way street, our health system. For some reason, Chantal thinks that she could just walk in, get the health care she needs, snap, 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 do it, do it, do it. Well, there have been instances where she has not gone out for her blood work. She had someone come in, not gone for blood work, missed countless appointments. If you miss an appointment, you can expect a greater wait time. And there's no doubt that she, as far as I know, or can see, that she has burned a lot of bridges within the Ottawa area healthcare system. If you miss an appointment, sometimes they can fine you. Most likely they don't. But it's definitely noted that you missed this appointment, especially if it's a test or a resource that's in high demand. So, in summation, her waiting 3 years to get treated for diabetes, bullshit. Bullshit, bullshit, bullshit. Anyways, thanks, guys. Have a good one. Bye now.